Hello dear viewer, I hope that you're doing well. This is a special episode of PCEA's Health Week 2021. Just a reminder that the theme is hope in times of crisis, quoted from Lamentations 3:22. Now, just to tell you that we have been looking at health holistically, that is mental health, physical health, and even spiritual health. So our focus of discussion today is the health of the eye, looking at different problems of the eye. And joining me is Dr. Wanjiko Muthe from Kikuyu Hospital, an ophthalmologist at Kikuyu Hospital. Daktari, karibu sana to the show, and thank you so much for finding time to join us this evening.
Thank you too. It's good to be here.
So what exactly does an ophthalmologist do?
So an ophthalmologist is basically a doctor who went back and specialized in eye problems. So I'm technically an eye surgeon. Yes, so I can handle any problems that occur in the eyes. Yes.
All right. So before we look at the different problems or eye disorders, let us just look at the parts of the eye. Yeah,
Okay.
we might be talking over the problems, but the viewer might not understand what parts does the eye have.
Okay.
Yeah.
So there are different ways of looking at the eyes. So you can have the anterior, so the front part of the eye that you see, that's the eyelids, and you can have the eyelashes, the conjunctiva, which is the white part of the eye. There's a thin film on top of the white part of the eye, okay, and that film is like a piece of nylon, so that's called the conjunctiva. Then the black part that we see actually has a glass-like covering that is called the cornea, and that's a very important part of the eye because it acts like our spectacles. It focuses the light onto the back part of the eye to allow you to see clearly. So most times when you need glasses, short-sighted, long-sighted, it is that part of the eye that is not able to focus on its own. So we add an extra layer that is the spectacles to enable the focus to reach the back of the eye sharply. Then we also have the inside part of the eye, that is the iris. That's the, so you see, you find in Caucasians it can be blue, green. Ours tends to be either brown or black, but also we have some Africans who also have blue eyes. The pupil, many patients tell me about my pupil has an infection. The pupil is just an opening. It is not an actual structure. So we have the pupil, which becomes wider when there's not much light, or becomes narrow when the light is too much. Exactly. Then we have the lens. There's actually a lens inside the eye. That is the one that is affected by this condition we call a cataract. Okay. So the lens naturally is clear, like a clean window. But as we grow older, or in case you have an injury, or some children are born with a congenital cataract, it becomes cloudy or white. Some patients, it's very advanced, you can see something white inside the eyes. So that is a lens that is cataractus. It's a simple procedure to have it removed, replace it with an artificial lens. And then you have the back of the eye, which is the retina, which is like a curtain. That is where you find the cells that receive the light and transmit it to the brain to give you what you call your vision. Yes.
Okay, thank you for that. Now, us looking at eye health today means that there's a problem, or there's a gap outside there. Maybe you can just share with us the prevalence of eye problems in Kenya, and working at Kikuyu Hospital, what number or how many people do you see in a day that have eye problems?
Oh my goodness. So the gap is huge. There are less than 200 ophthalmologists in the country. That's a population of over 45 million Kenyans. So the gap is huge. And of those ophthalmologists, most of us are concentrated in Nairobi. So again, the periphery get shortchanged even more. So at our facility, we see a minimum of 200 to 400 patients in a day. So it varies with seasons. For example, this past week, because we have had children on midterm, the numbers have gone up because children are coming to take care of their allergies, which is actually one very common eye condition. or also to replace glasses which have probably been broken during the school term. So the numbers fluctuate depending on the season. So that's our range, between 200 to 400 patients in a day. So what do we see commonly? We see lots of infections, and infections can really range to mild infections to very, very sight-threatening and even life-threatening conditions, infections of the eye. We see a lot of refractive errors. Refractive errors, we're talking about short-sighted, far-sighted, inability to read, which comes with age. We also see lots of cataracts, which I have mentioned before, very common age-related condition of the eye. We see lots of glaucoma patients. Glaucoma is a condition that affects the nerve of the eye. And with diabetes really affects the eyes. And I highly advise anyone who is diabetic, whether or not they have any complaints in their eyes, to have their eyes checked regularly by an ophthalmologist, not just going to check whether or not their glasses are okay, but we need to look at the back of the eye, so, because there are damages that can happen in the eye due to diabetes that cannot be reversed, but caught early can be prevented or even stopped. Yes. So those are the common conditions that we see at our eye facility. Yes.
So you've mentioned, of course, different conditions, and you've also mentioned the parts of the eye. Maybe with the different conditions, now you can just link them now to the different parts of the eye.
Okay. So let me start with infections, because they're very common, and I feel like we can work together with with our viewers at home to take care of or reduce the number of infections. So we have a very common infection on the eyelid. You can have either a stye, or we call commonly a boil. Sometimes it is painful, and that's when it's filled with pus. But then you can also have a swelling that is painless, and it's usually filled with fat. The eyelid produces a substance called sebum, and that sebum is part of the tear film. The tears are not just water; they also have a layer of fat that prevents the tears from evaporating too quickly. I want us to think of the eye as like the mouth. When the mouth is dry, it's very uncomfortable. The eyes as well always have a tear film to keep them from drying completely. And so there's always a level of tears in the eyes. So the sebum that's produced by the eyelid sometimes gets blocked, and the fat accumulates and causes a lump on the eyelids, which is a very common complaint. So what I would advise the viewer is, as soon as they notice the swelling, the faster they come to the hospital to have it attended, then the faster we can assist in probably avoiding surgical intervention for the swelling. The eyelids can also get something we call cellulitis, redness and swelling of the whole eyelid. And that is something also that we see quite a bit of, especially in children, and might need antibiotics, oral antibiotics, or even sometimes intravenous antibiotics, depending on severity of the infection, because that infection can go from the eyelids and into the back of the eye, and even the inside of the eye as well. Something that I've seen quite a lot in the past 1 week is the pink eye or the red eye. Happens a lot when we have flu, and we are currently going through a severe flu season, and therefore also quite a number of children are coming with flu and the pink eye. So the pink eye can be either viral, the eyes and the nose really, and the ears and the throat, they're all interconnected. So you easily find someone with a flu has an ear infection, or also can extend to the eyes. So it's very common connection. And so it can either be viral, or it can also be bacterial. I have encountered quite a number of patients who have gotten over-the-counter medication. There's a very common medication that called Probeta N. That's
it's being misused.
It's being misused so badly. It's a very strong medication, and if we give it, and it suppresses immunity, okay, and it has its uses. There are times when we would give Probeta N, but when it's given in the wrong setting, it actually makes the infection worse. So you have lost eyes because of use of Probeta N for a prolonged period of time. This is a medication that is very easily available. It is cheap, but it can cause a lot of damage. So I strongly advise people to not buy over-the-counter medications for pink eye. We need to assess, is it viral, is it bacterial, and then determine the way forward. Yes.
Okay. So in that thought of line of thought, let us just look at, you've mentioned of the boil, yeah? And you've also talked of over-the-counter medication and the importance of visiting hospitals for an expert just to examine you. We've had people, and it happens, yeah, especially in the rural areas and communities, where once they have the boil, they'll go ahead and try to, press the pus out of it. Then once the pus is out, they think or assume they are better. What are the dangers of doing that?
Well, that's probably the same thing we were going to do at the hospital anyways.
Is it because it's just not being done by a profession? Or?
My concerns would be the cleanliness of the hands that are doing it, and whether it's been done appropriately. I mean, what are our grandparents doing before? So I'll not villainize the action of busting the boil. If it's right, maybe perhaps use some spirit and some cotton wool. We may not all have access to the doctor, and that's what you are coming to have done anyways. Yeah, but let them wash their hands with soap and water, have some spirit. I think that's what our moms used to do, that's what our grandparents used to do. So yeah.
But after that, would you recommend for an eye checkup?
I would always recommend for an eye checkup, whether or not there's a problem. It's good to have regular checkups. Yes.
Okay, talking of eye checkups, maybe you can just share for the disorders or problems that you've mentioned, what signs and symptoms do they come with, or does it just happen that your eye tend to be painful? Or?
Okay, that's a good question. So you have conditions that will be so loud, for lack of a better word. For example, the red eye. Everyone will keep telling you, hey, your eye is red. Or maybe you don't feel anything, but because, people keep commenting, then that will force you to come to the facility. And yet it's as simple as giving you antibiotics for a few days. Okay? Then you have more dangerous conditions that you don't notice until it's too late. Okay, cataracts develop slowly over time, so the patient will start finding the vision is cloudy or blurry. They might decide to get glasses, and that will help for a few months. But the vision keeps getting more and more cloudy until they present to the ophthalmologist. That's number two. But it's not painful. I mentioned diabetes. You will not feel any pain. So they'll keep going to the diabetologist, hopefully, to keep checking on their sugars. But if you don't keep checking on your eyes, then no one will know what is happening inside the eyes. And if we wait until the vision has been highly affected, sometimes we can intervene, and other times it is too late. But again, it's a painless process, and it happens over a period of many years. So in diabetes, we don't usually see any signs inside the eyes for the first 5 to 10 years. And also it depends on the severity or the sugar control. So well-controlled sugars, actually we rarely find anything inside the eyes. You have other conditions like glaucoma, which is gradual progressive nerve damage that is irreversible. And these are patients who will hardly ever feel pain. So by the time they present, we are presenting late. We cannot reverse the damage that has occurred. So really, I think my take home is regular eye checkup by an ophthalmologist. Yes.
Okay. You've just mentioned or linked diabetes to eye problems. Yeah. There is I had, or from my research, I understand that kidney failure can also be linked, or eye problems can also be linked to kidney failure.
Yes.
Maybe you can just expound on that for our audience to understand.
All right. Right. That's good research. And this is the explanation that diabetes is actually a disease of the blood vessels. So the small blood vessels, those are the micro vasculature, and the macro, the big blood vessels, macrovasculature. So microvasculature, you find tiny blood vessels. Remember the capillaries? You find them in the eyes. You also find them in the kidneys. So any damage that the diabetes will cause to the small blood vessels, you have small blood vessels in both the eyes and the kidneys. And it has been found that the extent of damage you find in the eyes correlates to the extent of damage you expect to find in the kidneys, because the caliber of the blood vessel is the same, and diabetes affects the whole body, all the blood vessels in the body. So that's the link, that it's affecting all the small blood vessels equally, and you have the same caliber of blood vessels in the eye and also in the kidneys. So the excessive amount of sugar in the blood, as happens in diabetes, damages the wall lining of the blood vessels, and therefore they become more porous, they become leaky, they start to swell, and they even start to rupture, and you have small spots of bleeding inside the eye and swelling inside the eye because of the leaking. So there are parts of the eye that don't want any liquid. We just want blood vessels can bring the oxygen, can bring the nutrients, the sodium, the potassium, the electrolytes, and then take away the debris. But when you have the blood vessels that are not functioning properly, that are leaking, then they start to cause problems inside the eye. The eye wants to be very clear and not have any clots or blood inside it. It interferes with the vision. Yes, so that's a link between the two.
Yes, thank you for that. Now, you've mentioned age as a, maybe, let me say, a risk factor.
It is.
What are some other causes or some other risk factors of eye problems, maybe looking at it either naturally or just biologically?
Okay. Smoking. Smoking is a huge factor that we can control. Smoking actually worsens glaucoma, worsens cataracts, and actually worsens a condition called age-related macular degeneration. That is damage to the retina. Smoking is a huge factor that we can control ourselves. There are children who are born with conditions such as cataracts. You have congenital cataracts, you have congenital glaucoma. So there's a small section of children that will get the congenital conditions. Another risk factor, as I mentioned already, diabetes. Diabetes is a risk factor of quite a number of conditions in the eye, other than the damage to the blood vessels. Also accelerates formation of cataracts in the eye, and they tend to get dry eyes a lot. As I mentioned, the eyes don't like to be dry, just like the mouth. The mouth does not like to be dry, the eyes don't like to be dry either. But we find that diabetic patients tend to get dry eyes quite a lot more. Children, I don't know if it's a factor of their immunity. Anytime they go to school, the flu season, and also touching each other, getting the flu and getting eye infections, very, very common. And their parents, their minders, their guardians in turn very easily get eye infections as well. So those are the risk factors and the groups at risk. Although I think all of us are at risk.
At risk,
Yeah.
Okay. So if we as Kenyans or we as human beings do not embrace eye checkups, what is the worst that can happen?
You know, could be nothing. You know, we might be the lucky ones who never have any cause for alarm. However, once we hit the age of 40, just like any other part of the body, very important that we get annual checkup. So you asked a very good question about presentation. There are conditions that will never present with pain or loss of vision until it's too late. Until it's too late. So we don't want to get that. If you have access to the facility, why take the risk? There might be nothing to find. Well and good. And then a huge number of patients will not have anything to worry about. But then a small percentage, and that's a percentage that we really want to see. That small percentage is the one that we are encouraging. You might be in that percentage, you might easily be one of the many who really didn't need to be seen by the ophthalmologist. And that's why we call it screening. We are ruling out any issues. You're good to go, you're good to go. That 1-2 patients that we find that do need our intervention, those are the ones that we need to find out. Where are you? Don't wait for the pain. Don't wait for the poor vision. Just come. The earlier we catch this condition, the earlier we can intervene and save sight. Yes.
Okay. Thank you so much for that. Dear viewer, just a reminder that we are looking at eye health, just looking at the different or common problems of the eye. We've looked at where the gap is, and we are taking a very short commercial break. We will be right back after a few to give you the solutions.
Our world needs humble, confident, bold, and integrity-infused leaders.
Live online, Thursday through Friday, October 14th and 15th, 2021. Join thousands of curious, growth-minded, change-driven men and women like you for the premier leadership event of 2021, the Global Leadership Summit. Some of the world-class faculty includes Craig Gauchel, Senior Pastor of Life Church, Jami Lima, Richard Montanes, who started off as a janitor and rose to be a top executive. Local faculty include Justice Daniel Masinga, who'll talk about the quest for justice, fairness, and equality. Bishop David Oginde, CEO and founder, the Carter Lead Associate. Daniel Kamau, CEO, Fusion Capital. Archbishop Eliud Wabuhala, Chairperson, Ethics and Anti-Corruption Committee. Among other speakers, guest musician will be Florence Morethi. To register, call 722-490325 or visit www.kenyaleadership.org. Everyone wins when a leader gets better.
Our esteemed viewers, praise God. This Sunday, CAC TV, in conjunction with the CAC session and the Fraternity of PCA Nakuru West Parish, led by the Parish Minister Reverend Edward Gathegi, invites you to the climax of 2021 Health Week from 9 a.m. The service will be led by the Secretary of the PCA Health Board, who is also the Deputy Secretary of PCA, Reverend Paul Kariuki, while the guest preacher will be the Very Reverend Dr. Jesse Kamau, the Chairman, PCA Health Board. The service will reflect on the theme Hope in Times of Crisis from Lamentations 3:22. In the afternoon, join us for an exciting session of Youth Tuko program from PCA Molo Parish, hosted by Reverend Anthony Miringu, the Director of PCA Youth Department. The service is proudly sponsored by PCA Nakuru West Medical College. Tune into CAC TV and Signet, CAC TV Kenya on Facebook and YouTube to fellowship with us.
Well, welcome back to the second part of this episode of PCA's Health Week 2021. We are looking at the health of the eye, looking at common eye problems with the help of Dr. Wanjiku Muthe, an ophthalmologist from Kikuyu Hospital. Now, Daktari, we've looked at various problems. Maybe for a viewer that is just joining us, just a brief of what we've looked at during the first part.
All right. Perhaps it is you I should ask to see
The question is, yeah, whether I've understood.
Okay. So we covered the infections, different parts of the eye. We've looked at diabetes and how diabetes affects the eye, and that connection with between the damage to the eyes and comparative damage to the kidneys as well. We've looked at cataracts. We've looked at glaucoma, which is damage to the optic nerve. That's the nerve of the eye. That's basically what we have covered. I would also want us to touch a bit on allergies, because we encounter that a lot here in Kenya and in Africa. One, Africans have stronger immunity. That is scientific, and therefore we mount up a more aggressive response to something as innocuous. So allergy is an overreaction to something that is natural, like dust. So I may not have allergies, but we expose the same amount of dust, but your immunity acts as if dust is an enemy, and therefore begins to attack any dust that gets into the eyes. Okay, so allergy is not just to dust. It can be to smoke, it can be to pollen. Pollen is a dust that comes from flowers and plants. Excuse me. We can have allergy to various things. So we get a lot of allergy in our setting, also because, I mean, when dust is all around us, we are forever in the farms, and we have greenery everywhere. Unlike perhaps in the West, where there's a lot of concrete everywhere, so they don't encounter dust as much. So that's two ways in which we get more allergies than you'd encounter in the West. And that poses a challenge to us, because along with allergies comes the risk to our vision in two ways. That constant irritation to the eyes actually can cause the eyes to become opaque. When the eye is constantly chronically irritated, it starts to cover itself. Okay, and I have actually seen patients go blind because of allergies, something that is very preventable. It is unfortunate that we don't have the best health seeking practices. So sometimes when the patient presents, something very preventable, like it's something that can be managed easily, like allergy, can actually lead to blindness. Okay. Another thing that allergy causes is a condition called keratoconus. Now, keratoconus is, I mentioned about a glass-like covering on the front part of the eye. So when you look at my black part of the eye, it's actually a clear glass bowl in front of the black part of the eye, and that is what is called a cornea. It has a nice shape like a bowl. Okay, but when you have a condition called keratoconus, instead of being bowl shaped like that, it starts to bend, okay, and become more steep, and that affects the vision of the patient. Now this condition is progressive, meaning you get glasses today, within 3 months you need to change the glasses again because the power has changed. Therefore the condition is progressive. The earlier we catch it, the better. It can be stopped. It cannot be reversed, but it can be stopped. And once caught early, the intervention is actually quite simple. We put a medication that stops the progression, makes the cornea stronger, and stops the progression of the condition. But again, when we come to the hospitals, when it is too late, then we need to do a transplant. What is a transplant? The bowl shaped, we cut out the central part, and then we put a graft. We take from someone else who has donated their cornea, and we put a graft on top of where the diseased cornea was. And that is an expensive process. And you'll be under medication for a longer period of time than if they had presented early. So this condition tends to affect the teens, late teens, early 20s. So I encourage anyone who suddenly develops poor vision, you suddenly need glasses in the late teens, early 20s, to first see an ophthalmologist before they go get glasses. glasses are not the only solution or only problem that the eyes can have. And they might be just a stopgap. As I said, you get glasses today, within the next 3 to 6 months you need to change them again. We need to stop that progression. We need to diagnose early and intervene early so that we don't need to do a transplant. A transplant is an expensive affair that I would want to spare our viewers. Yeah.
Okay, and just a reminder to our viewers that you can send in your comments and question using our WhatsApp number. There is 0111220044. You can also send in your questions and comments on our social media pages. There is CAC TV Kenya on Facebook and YouTube. Now, Daktari, we live in a digital world, yeah? So how dangerous are electronic devices to our eyes?
They are such a catch-22. In the year, I think 2019, a study had been done in Asia, and it showed 50% of their children, 50%, are short-sighted. That's a huge number. The rest of the world is at around 10%. And therefore, there was a campaign going on telling the kids to go out and play. Reason being, when they start reading and looking at their gadgets at such a young age, the eyes never learn to use their distance vision. They're only using near vision, and that is the short-sightedness. They don't need to look off into the distance. Therefore, there's a huge campaign going on. Go out and play, go out and play. Then came COVID. So what do? We started working from home. We are working on our laptops. We started watching more YouTube, more using social media more, because we couldn't go out and be social. That is how we kept in touch with our parents who we couldn't go and visit. That's how we kept in touch with our people who are, or we did job interviews. That became the new way of life. So we can no longer demonize the gadgets. I remember my children were doing school online. So my campaign for the last many years to avoid buying them tablets and keeping them off of TV all went down the drain, because now every day for about 2 hours they had to be on their laptop doing class. So we can't escape gadgets, and we need to learn how to live with them. So there's a 20-20-20 rule. Every 20 minutes, give your eyes a break for 20 seconds by looking off into the distance of 20 meters. Okay. When the eyes are doing near work, when you're reading, when you're on your tablet, you're straining your eye muscles. That is work for the eyes. Rest for the eyes is looking off into the distance, and that's why we are giving you a target of 20 meters every 20 minutes for 20 seconds. So you count 1 to 20 in your head. I tend to modify that and say give it 30 minutes. Take a walk, go to the washroom, because remember, also being seated for a long period of time is not good for the blood flow, and we're increasing risk of clots and all that. So why can't we combine the two? Get up, go, wash your hands, take a sip of, drink something, say hi to whoever is in the house, friends, colleagues. We are assuming we're still working from home. Wave at someone. By the time you're done, you didn't even need to count the 20 seconds. Take a sip of water, come back, sit, continue. You've given rest to your eyes. You've worked your calf muscles. That's the leg muscles, and we've accomplished 2 in 1. So every 30 minutes. Actually, being on the gadgets for too long, we have found you blink at about 20 to 25 times per minute naturally. But when you're concentrating, when you're reading a very interesting novel, when you're on the gadgets, when you're doing your deadlines, it actually drops by about half. And the eyes tend to get dry a bit more. So people who are on tablets and our gadgets for long, our teenagers who sleep with their phones on Instagram and all these other social media platforms, are complaining that their eyes feel like there are particles in their eyes. It's a very common complaint. And resting and limiting the time we are on our gadgets unnecessarily needs to happen. We really need to have that discipline to not be on our phones for too long. But also when we do need to, because sometimes you have a deadline and you need to work until 2 a.m. What do? work must be done. Then develop that culture of resting your eyes, giving your eyes a break regularly. Yes.
Wow, I love that preventive measure. And it's interesting that I've just learned of the distance now from the gadget to and what it can do. Well, thank you so much for that. It's quite eye-opening. Yeah. So talking of that preventive measures, maybe you can just also look at some other solutions, maybe home remedies for the different eye problems that you've mentioned.
Okay, good. So we mentioned about infections. Okay. First thing I do when my children bring eye infections in the house is warm water, warm salty water. We've heard about this before. So let me give you the ratio. 1 cup, normal teacup, should be about 200-250 ml. Warm water, not hot. Warm water, half teaspoon of salt. Mix that. Use cotton wool. I insist cotton wool and not your face towel, because even when you wash your face towel with soap and water, it doesn't really become disinfected. Okay, there's high risk of reinfecting yourself. So I insist on using cotton wool. So the warm salty water, dip it, just clean the outside of the eyes. It actually works the earlier we start, so that we don't wait until the infection, the eyes are really pouring out lots of discharge. Anytime you see more discharge than usual, slight reddening or pink discoloration of the eyes, start immediately, 3 times a day, like your meals, breakfast, lunch and supper. That really helps. I also advise that my patients do that even when I add antibiotics. If I find a patient has an infection in the eyes, I advise that warm salty water as an adjunct to the antibiotics. I have found it really helps to fasten the healing process of the eyes and the infection. So that's something we can do at home. I usually will start that on my children before I determine whether or not I need to add any medication, and more often than not, the infection clears without needing to add antibiotics. So it really works. So let me repeat: 1 cup of warm water, half teaspoon of salt, and cotton wool. That also is very important. Another thing that we can do, if there's the sty or the boil, same thing, warm salty water, but now with massage. Oh yeah, I sanitized my hands. So massaging the part that is swollen, going towards the eyelashes. So the outlets are at the base of the eyelashes. So if your swelling is up here, you want to massage going downwards, okay, towards the eyelashes. If the swelling is on the lower lid, then you want to massage going towards the eyelashes, okay. So again, 3 times a day, and if that doesn't resolve, please come to the hospital. I usually will give 2 to 3 days of observing whether or not your remedy is working. Similarly, when I start a patient on antibiotics, I tell them I give you 2 to 3 days within which you should see improvement. If you're not seeing improvement, that means whatever we're doing is not working. So I either need to change the medication or increase the frequency of the medication. So same for them. If the home remedy is not working within 2 to 3 days, please come to the facility. Moms who are taking care of children who have infections, please remember to wash your hands before and after you take care of the eye, so that we don't also get an eye infection as well, which happens so easily. Another thing we can do at home for patients who have allergies. Now, this is different from the patients who have infections. These ones I will advise cold water. So what happens is, if you have particles on the eyes, so let's first talk about what we can avoid. We talked about dust we can't avoid, so we'll not tell the children not to go out and play. Let them go out and play.
It's healthy.
It is very healthy. Remember, there was a campaign telling other children across the country to go outside and play. So let's encourage our children to go out and play. We're also avoiding obesity. It's such a catch-22. So let them go out and play. But then when they come back to the house, wash their face with tap water. The cold soothes the eyes, because when they are itching, the eyes feel like they are burning. So you don't want to add warm water to their eyes. So the cold helps. Sometimes the weather is too cold and the mothers will complain to me, "Ai, kuna baridi." Okay, take a face towel, wipe. What you're trying to do is, sometimes you might have dust on the eyelashes that is irritating the eyes. So washing, just washing, helps to soothe the eyes and removes the dust or whatever particles, the pollen, from the eyelashes and from around the eyes, and to stop the irritation. And washing is something you can do 100 times a day. It's not like medication which you put 3 times a day. So wash, 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 wash. Just rinsing, rinse, rinse, rinse. We can't avoid dust, but you can avoid smoke. Don't give that child work to sweep or to go out and pick the leaves or to the shamba. But can give them work to do dishes. They can wash their socks, they can wash their clothes, they can wipe the table. So give chores that are not dust related. So we'll often write letters to schools to tell them, please, let them not do these jobs, but let's not treat them too special. They can do, so let them not rub the dust, the chalkboards and such, but they can wipe the teacher's table. They can do cleaning. So there are some chores that are okay, but others they need to avoid. No one should be smoking around these children. If one of the parents or both or a relative is a smoker, let them do it away. Let's not give them work that involves smoke, lighting of the jiko, or going when they go up country. Even here, if we're using the wood, let them not be around such an environment that has smoke. But they can definitely use gas if they need to cook. What else can I think of for patients with allergies? Let's not wait until they're too advanced. Some eyes that look so red, you can see them from, Let's not wait until, again, there are children who have gone blind because of allergies, and that pains me, because those are patients you can't even put a transplant. Their eyes, the damage, they reject those transplants. So let's not wait until the eyes are so red or the eyes are so swollen before we bring them to the facility. The earlier they come, the fewer the medications we need to give. Sometimes I'll give one patient only one medication to give in the morning and the evening. But when it's too advanced, sometimes I have to give injections. Sometimes I have to give medication every 2 hours and another. That's not what we want. So the earlier they present, the better. Yes.
Wow. Now, let us, you've talked of the remedies and the solutions. Maybe you can touch on food and diet, what type of food to eat to improve and maintain good eyesight.
Okay. Well, it's not an off question. There is vitamin A. There's this, it's not untrue that carrots are good for the eyes. They are, mostly because they contain vitamin A, which is very good for the eyes and very important, because there are people who actually go blind because of vitamin A deficiency. Who are these? Children who are malnourished, pregnant and lactating mothers, prisoners who have very poor diet. But your normal average person who has access to normal diet, you're good to go. So there's, well, eat your carrots. Please go ahead. Nowadays it's a rare condition, getting vitamin A deficiency. But yes, a good balanced diet goes a long way for every part of the body, including the eyes. Yes.
Exercise, does it play a role?
There are some exercises that we give for patients who have some muscle, but their eyes outside the eyes, there are muscles, on the outside of the eyes that control your movements, like left, right, up, down. So sometimes when the muscles are weak, they've been affected either by a stroke or some injury. There are exercises that we give to those patients. We also have children who have a squint. A squint to us is eyes that are not facing straight when I'm trying to look at you, one eye is going out or in. That is the definition of a squint to us. So there are eye exercises that we also advocate for such patients. Now, this other exercise of the treadmill and going out, well and
for
good.
General health.
It's good for you, so do it. So do it. But we do have specific eye exercises that help the muscles the eye muscles to function properly.
Yeah, great, thank you so much. Now, anything that you'll want to add, or just a parting shot from you?
Okay, so coming up on the 14th of October is World Sight Day. What we would want as the ophthalmology community is for many people to show up for. So I'm sure there'll be very many facilities offering free screening and such. Whether or not you have an eye complaint, just come. Just come for screening. As I mentioned, not everyone will have a complaint. You may not notice. Just come. Take advantage of that opportunity to be screened, especially if you're above the age of 40. If you've ever had an eye issue, present yourself, allow us to serve you, allow us to have a look into your eyes and know whether or not there's something that needs to be attended to, or at least give you that assurance that your eyes are good. Yes.
Will Kikuyu Hospital be having the eye checkup?
Yes, and we shall be announcing that soon. Yes.
Great. Thank you so much for your time, and thank you for the information on just how to improve our eye health.
You're welcome. Thank you for having me.
Great. Well, that was Dr. Wanjiko Muthe, a consultant ophthalmologist from Kikuyu Hospital. She has helped us understand the health of the eye, focusing on common eye problems and also looking at solutions in terms of prevention and maintaining good eyesight. I've been your host, Aida Munzatsi. Remember, this was a special episode to mark PCEA's Health Week 2021. The theme is Hope in Times of Crisis, quoted from Lamentations 3:22. Thank you so much for tuning in. Stay healthy and have a blessed night.